Welcome to Friends with Fertility, the podcast where we dive deep into the world of fertility, reproductive health, and all the emotional journeys that are in between. I'm your host, Elizabeth King, a fertility expert dedicated to providing you with the knowledge, support, and inspiration you need on your path to parenthood. Whether you're just starting out, exploring your options, or looking for solidarity and advice, we are here for you. Let's embark on this journey together and turn uncertainty into empowerment and make friends with fertility. Let's get started. Hey everyone, welcome back to Friends with Fertility. I am so honored to have Julie Morgan with us today. Welcome, Julie.
Thank you.
Julie is a reproductive nurse specialist with nearly 40 years of clinical experience, including 35 years in IVF and women's health. She has managed two of the world's leading fertility clinics and currently chairs the Education Committee of the European Fertility Society, where she develops educational resources and supports practices across the fertility sector. She is also a PhD researcher and works in research and development using her extensive clinical and leadership experience to help drive cutting-edge technological advances in IVF. She is a recognized specialist in understanding the cultural differences and legal frameworks that shape fertility treatment internationally, with a particular focus on balancing evidence-based innovation with ethical, patient-centered care. She is a founder of HoloFertility and All About Infertility, and is widely known for translating complex reproductive science into meaningful, accessible insights for patients and professionals, which is so needed. I feel like we're kind of in this new realm of fertility that is confusing for a lot of people and also very exciting. Nonetheless, the old world of fertility, let's say, of somebody walking in the door, that it is a whole new language of understanding what's what and things that they haven't, we're not prepared to be learning as they get into it. So thank you for making that effort to break it down for people who are kind of learning as they go in a situation that they probably had never found themselves to be in. So how did you get into this whole world and really making it your mission, it seems?
Fertility in the first place is a very long time ago. I looked after my first IVF patient in 1987. And I was in London. I was running the gynecology ward at the Humana Wellington, as it was in those days, in St John's Wood. And we had a lot of the late Professor Kraft's IVF patients on the ward. And I used to do ward rounds with him. And long story short, I ended up working with him. I was his nurse manager in the early 90s.
That's so exciting.
And then,
did you know at that time how revolutionary it was?
It was a really good time. It was just such an exciting time. Everything was so new. In those days, we didn't even have ICSI. So,
Right, of course.
I cannot stress how different it was then to now. We used to see really significantly bad OHSS daily. We would have an ascites tap daily. And that was just because in those days there were no blood tests. There just wasn't what we have now. And so it's been fantastic to see how things have moved on and, just to follow the journey. And I've been incredibly privileged. I've been on the teams of like the first ICSI, the first egg freezing, the first genetic screening, the first safety, a whole load of things. So it's been a really privileged journey that I've been on.
That's
Loved
amazing.
every minute of it.
That's so incredible. I get goosebumps just hearing you say that. It's interesting to think of the bigger picture of this new technology then especially happening, and of all the people and all the nurses that you get chosen to be in these positions time and time again, what an amazing experience to be able to be at the forefront of that. That is so cool. So what is the European Fertility Society and what is its core mission?
EFS is a non-profit organisation which is there basically to support patients. We're not trying to be ESHRA or ASRM, or we're not a science-based organisations. We are there first and foremost for patients, to support patients, but also to support staff. We know that life is not easy for clinical staff either. We all need the support. But it's there as a a trusted space, and our remit is that everything that's there, we've got a lot of education and training and certification things. All of the education is free. It's all freely available. Or everyone that is in the EFS is a volunteer. None of us are paid. It's for all of us. It's our way of giving back to the community that we all just love so much. It's not been going
Mhm.
very long. It started in COVID, during the COVID time, just as a reaction, really. Those of us that were there around at the time just remember how there was just such major gaps in emotional support at the time.
Mhm.
Clinics were trying their best to keep up. Clinics in the UK, it was very difficult for us. And, I don't know how it was for you over there in America, but in the UK, we didn't know from one day to the next whether we were going to be allowed to practice the next day. So we weren't able to tell
Right.
patients. We just did the best we could, and there were gaps. There were big gaps. We know that now in hindsight. And so the EFS was born, and it just evolved, and they put on live events, and we ended up doing 100 live events in just a couple of months, because there was just so much. It was overwhelming, that the need that was there for it. Um, and the actual EFS was then formalized and born properly in December 2020. And we now have over 1,700 members from 96 different countries. So we're getting bigger and bigger. The need is definitely there. The support the
Mhm.
support mechanisms need to be there for patients. We all work in IVF clinics. No one's saying that IVF clinics don't do that. Of course they do. But I think the more we recognize that patients perhaps need different things at different stages of their journey. I mean, a patient who is just starting to think about IVF treatment is very different to a patient who's had a couple of negative cycles, for example, or is on their or is coming back to use frozen embryos after they've had a positive pregnancy. And everyone's at different stages, and that's what we're trying to create as an organization, is education for all those different stages along the journey, to understand that people are at different stages.
Yes, and it's so needed. It's an amazing group. I think I am part of it as well. And,
Mm,
speaking of COVID, I had so many patients in England, in Australia, in other places other than the US. I think we're at 25 countries now that we've helped support, and it's different everywhere, but specifically in those that were, um, their healthcare is a little bit different than America's. It
mm,
had this whole other emotional situation coming along with it, about the uncertainty and the time frame that we feel that we're under with IVF, right? We don't have these huge time gaps that we can just usually wait around to see
no.
when things are going to open up again. So what a beautiful opportunity during that time for you guys to help support. And to your point, also with the staff and the nurses and the people that are in the clinics, I remember from my own journey crying with the phlebotomist there. She's taking my blood, knowing as a coach, I have been in the mental health space for many years. I knew full well she wasn't prepared to be, dealing with my emotions as I'm sitting there. But they end up kind of trying to play all these roles, whether it's a nurse or a phlebotomist or the front desk or the doctor. And I always say that's not, they're trained in a certain field. And if we can all stay in our lane and grow our fertility team, meaning we have our therapist or our coach, as well as our nursing staff and our doctors, et cetera, we all work together to build the patient up for better success and faster success, hopefully, if they're feeling supported in that way. So I love that it's this umbrella of everybody kind of getting what they need in different areas, because you're right, no story is the same, no person's situation is the same, and everybody comes at different ways to the journey. And it's so important to acknowledge those different places and the different cultures that they come from, right? Somebody who is
Yeah,
in the Middle
absolutely.
East versus someone who's in South
Mm,
America to America or the UK, they're dealing with even different things. I always say the emotional journey on fertility is the same, the medications are the same, but what we go through with our backgrounds is different as well. So just acknowledging that, I think, is huge. So what has inspired the evolution and the karmic gaps, I guess, between this awareness? As far as, I think, one, like you're saying, the technology is changing, right? So it's constantly evolving of what patients need, what the practitioners and professionals need as well. So how do you guys start to fill in those gaps and recognize, okay, we need to move more towards this direction, and addressing those
Yeah,
things?
we don't actually look at it as gaps, to be honest. It's more the whole overview of everything. I think certainly if we look at like the education committee, for example, um, there's quite a few of us there now, all specifically hand chosen because they're people who work in the industry full time, day to day. They've all got hands on care, but from very different worlds. We've got myself as a nurse, we've got very senior embryologists, doctors, counsellors, patient advocates, male fertility specialists. Mel, who's a solo parent coach, so she does a lot with donations and all these types of things. So we have a big team that covers the whole journey, all the different complexities of it. And as I say, what we try and do is look at the fact that patients are at different stages of their journey. Um, we've not been going very long. I mean, the education committee, for example, we've only been going for a year. So our primary focus initially was to just get as much information on the website on paper as possible. And so how I've done that is to I focus around a monthly newsletter, pick a different topic each month. And I started with the microbiome last year, and purely selfishly because it's my area of interest. I believe very strongly that we're ignoring it, and we shouldn't be, because
Amen.
it
Yes.
is, I've done a lot in reproductive immunology. In the last one that I did, I've just written 7 articles on the reproductive immunology. They're on the website now. But my focus originally was the fact that the microbiome does affect it. In my personal opinion, it does big time.
How
And
can
so
it
we
not?
started.
Is
How can it not? How can it not? So we
Yes.
started with that, and we also started with the cookery school as well, because fertility. We all know that what we eat affects fertility, and it's just this whole vision of you can't. I think as clinicians, historically in IVF, what we've done is split everything up into little pieces. So you've got male fertility, and you've got microbiome, and you've got reproductive immunology. Well, they're all part of the same thing. We should be looking at a patient as a whole, not as a little series of bits and pieces. And so that if it's no
Amen,
gap,
Julie. I
but
don't, I mean,
that's kind of how we look at
yes,
it. That's how I look at it, certainly. And
right.
as the chair, I'm afraid I'm kind of pushing it my direction at the moment. And thankfully, so far,
As,
everyone's going with me, which is fantastic.
yes. And to that point, I don't know if you notice so much there, but I am seeing an influx of doctors that are coming up that are kind of starting to get on board with that, right?
Mm,
Previous
yeah,
doctors, I would say, they wanted to stay in their lane, and I'm worried about, my doctor, even, I'm not going to do IUI, but I'll do IVF because I know I have 60% chance of getting you pregnant. I can get the sperm and the egg and put it in a dish, and here we go. I had huge gut issues. You never asked me about that. But I think
mm,
that this younger generation of doctors, of REs that are
mm,
coming up, recognize not only is it gut issues, as well as the serotonin receptors in our gut, right? Like everything is involved in this and affects the patient outcome, and therefore affects the success rates of these patients. So are you noticing that we have doctors that are kind of more getting on board of looking at the bigger picture rather than
Oh,
just
no,
kind of the
definitely,
old
definitely,
school?
absolutely. And if we go back to the microbiome, we did a research. We've done five unique research projects now in the last 12 months. We've presented 2 of them already at conference, the one on the microbiome, the one on AI and digital health. We've got 2 more at ASRM coming up in October. But the microbiome, for example, 100% of professionals that we asked wanted to know more about it. 80% of patients wanted to know more about it. So we know that it's out there. We know that
Right.
people want it. But to be fair to clinicians, if it's not, if there's not lots of research out there about it, they don't know where to start or what to do.
Right.
And you
And
know,
that's not what they were taught, right?
that's not what they were taught.
That's
But also,
right.
it's a bit like reproductive immunology. I would say IVIG intralipids work categorically, but only in a certain patient at a certain time, at a certain dose, for a certain reason. If you gave
Mm,
everybody IVIG and intralipids, of course it's not going to work. But that's
right.
then what the research says. And we're at this,
Hmm.
we always have to go through these steps. And one of the great things about being in this for so long is to know that we will get there. There's a process that we have to go through to make clinicians feel comfortable with what they're doing.
Right. And I understand from the clinician's perspective too. It's a lot to get their head around.
Mm,
Was listening to somebody around a cancer doctor recently, and he's like, "We're doing it wrong. We need the immunologist, the virologist, and an oncologist to be looking at this cancer patient." I'm like, I feel the same way about a fertility
mm,
doctor. Like,
mm,
we need multiple specialties looking at this one patient to understand the bigger picture often, and it's hard to expect just the RE to know all of these things, right? And I think if we can get enough data out there and research out there, they can understand more. But also, I think we then run into, well, I've seen with my patients, is that they self-diagnose, right? They see one thing
yes.
that has worked and there's a
Yes.
study been done and they're like, "Oh, I got to do this," right? This worked for this person who'd been trying for so long and here we are. And so I think part of our job too is mitigating the education for them to understand you need to speak to your own doctor and figure out your own situation, because it varies so drastically based on what's going on with one person. But I find people are in such a desperate state that they want the latest and greatest thing that's coming out because they think this is going to be their magic thing that they're going to do. Do you see that often too as a situation for you all?
Yeah, of course. And I mean, it's the same for all of us. If you're in a situation, you want to take control. And if doing a microbiome test and taking a certain probiotic makes you doesn't make you feel, that's patronizing, but you believe very strongly that it will make a difference, then of course you're going to. And of course you're going to.
Hmm.
And that's why, we started, one of the first things we started was the cookery school, because that's such an easy thing, research based, evidence based, to be able to show you can make a difference. You can take control. There are certain things that you can do. But
Hmm.
yes, and I mean there was some research came out last week about social media and what a problem it is, really, particularly in our world, uh, is because patients do latch on to the latest thing.
Hmm.
And the way the
Right.
social media works with the algorithms and things, whoever's shouting loudest is going to be seen the first. Um,
Of course.
and how do patients know? And that's one of the one thing that we really want to get across at the EFS is this is what we're saying is a safe space to, we try and give all the different points of view. And when I write something, my name's on it. So it's my personal experience from what I'm seeing. Um, and for
Hmm.
us, I guess as well at the EFS, nothing's paid. There's no paid content anywhere. So it's not someone trying to sell something to a patient. And
Right.
that's our philosophy. That's where we're trying to get to, is to break down these barriers of misinformation and to try and get out
Hmm.
there evidence based, yes, but also, when you've been in something for 20 years and you have an opinion, we say it. And as clinicians we do say it,
Hmm.
but then we also say that our experience comes from this particular demographic of patient in this particular area, because
Right.
that's what makes a difference. And I think what
That's the
personally
important
what
part
personally what
that you
I
need to
what
hear.
I hate is when a clinician will go on social media and say this particular study has just come out, do not take prednisolone because this study said it doesn't work. Well, maybe it doesn't, but in that particular group of patients at that particular time, it's not to say it's not going to work for everybody. So I think it's dangerous. I think social media in that respect is dangerous, and I worry about it. I really do, and
I
I
do
don't know how to
too.
get past it. It's the way of the world now. I don't know how to. We can't backtrack from it, and I wouldn't want to, because done well, it's really
Right.
important done well.
Right. It serves its purpose in a certain area, but from what I see with patients, they go down this rabbit hole that I say you can't undo and unsee what you've read, and then it gets in their head, and they go down this other.
Mm.
It just ends up causing this spiral of other things,
Yeah.
and I feel like if they can have the curated information directly from who they're working with and their team, to know this is your body, and these are all the things we're dealing with, and these are the things that will work and that won't work, and we're going to try this and this because we haven't yet, and whatever. But social media is just like the forums and whatever. I honestly see more harm than done, because they get other people's stories in their heads, good and bad, right? They have this
Mm.
hope from
Yeah.
Susie Q
I
that
know.
she got pregnant because
I
she did
know.
this, and or they see really horrible situations, and they think that that's going to happen, so either way, I feel like it's a dangerous line to walk. How does the EFS ensure accessibility across countries and cultures? How have you guys navigated that?
We're very culturally aware, because culture makes a huge difference. And particularly, I mean, in Europe, all the different countries have different rules and regulations. So it's important that patients know that. We put out information in multiple formats, so that, some people will want to read, some people will want to watch a video, some people will want to watch a 30-second video of something very quickly, in, I think it's 6 or 7 different languages. But I mean, language in the future isn't going to make a difference anyway, with things like Google Translate and things like that. You and I can we can speak different languages. We're going to be talking together at the
Yes.
same time. So we'll get past that. And I think
Mhm.
that will then be really important. Um,
Mhm.
but that's what we try and do, is we try and give multiple formats of things. And the education program, for example, when we write something, we will write a professional version, which is very in depth and fully referenced, and a lay version, as we've already said that. But the lay version will be plain English, very easy to read, and all the references we have. It's my absolute bugbear that someone goes on social media and says, "This is a fantastic paper. Here's the link," and then it's £48 to download it. So everything that we
Mm.
do there's no paywall to any of it. I always double check everything to make sure that what we're doing is not paywalled, because I think that's just not fair.
And I encourage people to do their own research. Look at the studies
Mm.
that have been done. Take the study to your doctor and say, "What do you think about this? Is this relevant to me? Is this something we can look at for me?" I think the patients are so educated now because of social media and all the papers that are accessible to us, that I really encourage people to do your own research and have that conversation with your doctor to say, "I read this and I want to know more about this. What can they may not even know, but it will encourage them to educate themselves, even in a place that maybe they're not." And I think that that's fantastic, because patients are so well educated now. And I tell the doctors, you better be ready for them to come in, because it's no longer, even 15 years ago, walking in the clinic where anything they said, that was it. And now people are
Yeah,
coming in to say, "Hey, I want to try this. I heard this. I want to do this." So I
yeah,
really encourage looking at these papers and research that's been done to the best of your ability. Even if you still don't understand it, ask somebody to read it through with you, and ask those questions, because it is such great work that's being done, and it's changing all the time. There's new things that are happening every single day that can help in this realm. So resources and programs from the EFS that have been impactful for patients. I know you mentioned the education program and the cookery. Are those kind of the top ones that you guys see the most traction with? What else do you see that is
no, we have lots of things.
as far?
We've got something called My IVF Answers. So we've that actually started with the original thing. So there's now 600 plus recorded webinars on that. It's on the website, for all over the world, global experts doing a webinar each. Cookery School, the Educational Library, we're launching something at ESHRA called I Did Not Know That. It's a new campaign. So ideally, it's going to be like a little 30-second quick video. I will say some, I don't know. I did not know that I could pee straight after embryo transfer. Sounds a bit silly, but the amount of people that have said to me over the years,
Right.
is the embryo going to drop out? Nope.
Right.
And it's these silly little things that people Google at midnight. And that's going to
Of
be our
course.
next thing. So
That sounds
quick
so
30
fun.
seconds. Yeah, quick 30 seconds. It's meant to be fun. Quick 30 seconds of me saying, no, of course it's not going to fall out. This is why. But then we will
Great.
then signpost to a full-on version of this is what an embryo transfer is. This is why it doesn't fall out. This is what happens. So
Amazing.
that's the
That's
next
awesome. I
initiative.
can't wait. I
Yeah.
can't wait to see that. That sounds fun. Standards or practices the EVS advocates for infertility clinics. Can you tell us a little bit more about the?
We do. We're getting there. A couple of years ago, a number of us from the industry got together and wrote something called the Fertility Patient-Centered Care Guidance. I'm reading it because I can't remember what it was. It's on the website. It's a very big document. It's in two forms, a big one and a small one, and it's free to download. And it's all about training and best practice, and it was aimed at clinics. If you're a new fertility nurse and you want to look at what's best practice or what do I think I should be doing, you can download it and have a look. Same for patients. If patients want to know what should my clinic look like. So that was a little while ago, and we update that on a regular basis. And we're also just starting this year something called the Patient-Centered Care Clinic Program, which is it's an initiative that allows clinics to demonstrate their commitment to high quality care. So they'll basically be assessed and they'll be given a certificate to say that that's what they've been doing. We've done the first couple, and the first certificates are going to be awarded at ESHRA. And that's
Assessed
our
by
main
EF,
things apart from the education things.
assessed by EFS or with
It's EFS,
collaboration
but
with some. Okay.
no, assessed by EFS. There are a number of us that Claudia, who heads the thing, is a world-renowned expert in certification. She's put the program together, and there's sort of myself. I do a lot of regulation. A couple of others, a couple of the other doctors that are there that do that. So, yes, it will be those of us that are experienced in certification.
And do you find in the UK and Europe that there's still quite a few private practice open as far as fertility clinics, or are they more owned? Like in the US now, the majority of them are private equity owned now.
Yeah, no,
So
yes,
they
yes, I've seen that.
operate quite differently. And I've kind of personally run into situations with my business where I recognize the bottom line is really what they're after because it's owned by private equity versus,
Mm.
I've been in fertility clinics for 30 years and it wasn't like that when the doctor owned and practiced his
No, it
by
wasn't like
himself,
that. Private equity's changed a lot. Um, it's not like that here. In the UK, it's not like that. It's still very much. I mean, we have big groups owning clinics, of course, but it's
Mm-hmm.
not got. And there is private equity here. There is definitely, but not in the same way that there is in America.
Mm-hmm.
We have the NHS, so there is a little bit of
Right.
treatment. Unfortunately, it's very postcode lottery, so it's not much. In the rest of
Mm-hmm.
Europe, it depends very much which country it is. Some countries provide treatment, some don't. But I agree, it does make a big difference as to who owns the clinic, big time.
Mm-hmm. And again, it's because it's been such a rapid difference in the last few years here. It's really sad to me actually as we're trying to navigate the process with the clinics of the people that are making the decisions to the people that are there. They're getting a paycheck by the big banks, and so it's a little bit different, unfortunately, but hopefully we'll the pendulum will swing back a little bit. What do you notice the key differences between fertility care and Europe and the UK? If you guys are all so close but yet so different in the way that things practice, do you notice a bigger difference in Eastern Europe? I know we see a lot of patients, travel abroad to Spain and
Yeah,
as well as Eastern Europe quite a bit. Do you guys find the same?
we do. The Most patients travel for cost, either for
Yes.
cost or for to do things somewhere else that they can't do in the country that they're in. Um, Donor anonymity for things like that. Europe's strange because it literally varies so much country by country, and one of the big things that we try and get across to patients, not just through the EFS, but in the clinics, when we're doing consultations, is if you go to another country and have treatment, remember that you have to abide by their rules. But then it's also the rules of coming back. If you want to, say, make embryos somewhere else, you may not be able to bring them to another country. So it's understanding for patients all the different things that happen in different countries and all the regulations. So it's not just culture and it's not just cost. There are many things to think about. If you're going to use a donor, then is it anonymous? Is it known? How do you want it to be? Because sometimes it's not what patients expect. And I think we have a couple of people on the education committee that do consultations for patients for the donor things and things, and that's one of the biggest things they talk about is is
Mm.
is the expectations of that and understanding, and then also knowing how to not be stuck. I mean, how many people in COVID, and it still goes on now, doesn't it? That surrogates have uh, had their babies in other countries and then can't bring them back to the country that they want to be in, and it's very sad that when we get into that sort of
Yes,
situation.
it's unbelievable. Right. So, one of the main things that drew me to EFS personally was the fact that you guys acknowledge the mental health state of a patient. I felt that that was huge, and not a lot of companies and associations were bridging that gap between the science and the mental emotional side of it. And that's kind of my big push in all of this. So, how do you support the mental side of that? And I feel like, again, being from the scientific area that you are, that's not really something that's ever really been acknowledged. And still we fight against here as far as them recognizing, this matters. When we're walked out the back door after a miscarriage loss, like, that doesn't feel good. Who do we call? What do we do? And there's such a huge mental side of this journey, and the fact that you guys acknowledge that and bring it together, and also acknowledge the people that are supporting the mental side of it, to me is amazing. So what made you guys think, like, we have to acknowledge this side of the patient care as well?
I don't know, Elizabeth. It's difficult because it's something that I've never quite been able to get my head around that people don't do. Um, it's just part and parcel of it. But certainly for the
You would think,
EFS,
but yet it's
I
not,
know.
right? I mean,
I can't
as a
quite get my head
patient,
around
it's
it.
not.
I
Yeah.
know, I know. For me personally, it's always been an easy thing because coming for the last 20 odd years from a clinic that does blood tests daily. So you're talking to the patient daily, you
Right.
see the patient daily, you build up a huge, wonderful
Relationship.
relationship with your patient. So
Mm-hmm.
I've not been in other places that do it differently, but obviously, you talk to people, you see it. For the EFS, emotional support is not optional. It's integrated. It is absolutely part. You don't have one without the other. No,
Right.
it doesn't make any sense. Practically, there's a full chapter in the patient care guidance about it. We have training programs for staff on emotional well-being and things like complaint handling. Patients do get unhappy about things. Of course they do. They have a right to, and we need to be able to handle that properly in a timely
Mm-hmm.
way, in a sensible way. Um, we have regular webinars on the mental health impacts of fertility. And also, very importantly, again, we try to acknowledge the emotional toll on clinic staff as well. It's not
Mm-hmm.
easy. It's really it's
Absolutely.
really difficult to tell someone they're not pregnant, and if you're in a clinic where
Mm-hmm.
you're doing that more times than you're giving good news, it really does take its toll on you. And also, if 1 in 6 people is infertile, how many of your clinic staff are on their own journey? And they're
Right.
having to do that at the same time as they're trying to deal with, the emotional sides of patients. So there's a whole different, you have to think about all these different things, and we try to. That is the absolute center of where we start from.
And I can appreciate that on all sides of it. I also was a patient there every day, every other day, getting testing done, whether it was blood work or measuring follicles and all the things. And, again, being from the mental health side of things, I had an awareness of that, of what they are going through. And even the doctor, right, who had to tell me there's no heartbeat. Like, that's not easy to do. And to your
No.
point, you have a relationship with them.
Mm.
And, as much as some of them know that it's just another day in the office for them, it's life changing for us in every step of the way, whether it's a blood results that come back that we weren't hoping for, or our lining not being what it should be, or whatever. It's not an easy position, and I can appreciate that. And that's part of what we're trying to do here as well, is educate the staff to acknowledge and hold the space for the patients as much as they possibly can, but then also know that there's people they can send them to, right? There's coaches that are prepared to help, therapists that are prepared to help, and kind of what the differences are, and when to, suggest one or the other. So I just really acknowledge the fact that you can understand, and all of your team, that you don't have one without the other. And
No.
I've been trying to say this and banging my head against the wall here, that the clinic success rates are so much better when the patient
Yes,
is
they are.
emotionally supported.
Yes,
you know
yes. Yes, they
um,
are.
but again, here we're up against private equity most of the time, and unfortunately convincing them of that is a whole nother story. But how can people continue to learn from the EFS, and be part of it, even if they're not, in Europe? Again, I was drawn to it because I have so many patients and clients that are in Europe, so it was a natural fit for me. But I think the information that you guys are sending out needs to be global, and known all over the world. So how can people find you and work with you all?
We have a website. The easiest way is just through the website, the European Fertility Society .com. On there, you'll be able to sign up for a monthly newsletter. That's a good way of doing it. It means you don't miss anything. You see all the different things. Um, if anybody wants to talk to me personally, juliepatrickson@gmail.com. You're very welcome to message me privately if you want to talk to me about anything. But otherwise, just go through the website, and someone will get back to you very quickly.
And I just want to reiterate again, what they're doing with their research and their education is not just specific to, this is global. And if you're going through a fertility journey, it's the same wherever you are. There might be little nuances within your insurance, or your specific doctor, but on the whole, you will find that most of this information is relevant to you wherever you are in the world. So I can't say enough amazing things about what they're doing, and the education that they're putting out, and the fact that it's so accessible. So thank you so much. Thank you for your time, for being here,
You're very
and
welcome.
hopefully we'll meet again soon.
You're very welcome.
Thank you for joining us on this episode of Friends with Fertility. We hope that you found the stories, insights, and tips as inspiring and informative as we did. Remember, you are not alone on this journey. Your friends with fertility are here for you. If you've enjoyed today's episode, please subscribe, rate, and leave a review on your favorite podcast platform. And don't forget to follow us on social media for updates and more fertility resources. Until next time, stay hopeful and keep believing in your journey, and know that we are sending you lots of love.